All right. Welcome, everyone. Well, there's a lot of people still trickling in, but we'll go ahead and start our highly anticipated event. Um, it's honestly beautiful because if we look in the chat today, this is, well, as we talk more about the initiative, this is a McGovern-based initiative, but right now we have people ranging from physicians, people from the informatics schools, some nursing students, dental students. This is really a productive, diverse conversation, and we're so happy you came to join us today. And so, without further ado, we'll go ahead and get started. If you have not already, please take a moment to fill out this QR code. This is an opportunity to join our AI community. In the upcoming events, we're having speakers from the White House, Google, Harvard, Stanford, TMC. This is really like a great opportunity to just learn from leaders like Dr. Castro, who we'll talk about today. Okay, so essentially what like I'm Pranav. I'm one of the presidents alongside Matthew and Emily. And we're both second year medical students we're all three of us are second year medical students at McGovern. And so what really is going on? What is the initiative we're doing? Right now, there's this huge buzzword of AI that's trickling around healthcare, and it's pervading in different ways: clinical decision support system, predictive analytics, EHR advancements. Our goal is, as trainees and healthcare professionals in the TMC, how can we become more educated on like the different cutting edge applications of AI in medicine? And through bringing in very strong speakers from not only the TMC but also across the country, we can like create more diverse conversation and opportunities for collaboration on the future of AI in healthcare. And so some topics that we're gonna really focus on is we're gonna talk about wearable technologies, Fitbit, ChatGPT, LLMs, which is a huge topic today, robotic surgery, AI and entrepreneurship, digital twins, EHRs. Like the UT system is doing a huge transition to Epic with EHRs. We're going to talk about how AI plays a role. Any topic that has an intersection, we're going to try to expose our community to it. And if you have any suggestions, we're also more than open to that. But yeah.
Yeah, I'll just go over if you're from McGovern, our Bluebook credit requirements. So we set to 10-7 out of the 12 lectures mentioned previously, and to complete the pre and post program survey that will link in the chat soon. Oh yeah, or you can look at the QR code here for the pre-program survey to receive Bluebook.
Give everyone just a second there. Okay, and then the last initiative we're doing is, Pranav mentioned it earlier, it's both a YouTube series and a podcast, but we're interviewing different physicians just to see how AI is changing their particular field. So far we have 2 episodes out, but we've done a lot more interviews. We did one with the director of AI and cardiology at Mayo Clinic. We did one with a Harvard professor who started his own company. Sorry if I hear the background noise, but anyway, we'll link the link to our YouTube channel as well if you want to check out any of these that are your particular specialty of interest.
So without further ado, ladies and gentlemen, it is my absolute honor to introduce our distinguished speaker this evening, Dr. Harvey Castro. Dr. Castro, as commonly known, he's known as Dr. ChatGPT, and he's a globally recognized leader in artificial intelligence and healthcare innovation. After advancing clinical medicine as an 8-time ER Doctor of the Year and 20 years of healthcare leadership, Dr. Castro transitioned from a highly successful emergency medicine career to now becoming a groundbreaking force at the forefront of healthcare and AI innovation. Since then, Dr. Castro has been the CEO of 8 electronic health record systems, the author of 23 plus books on AI and healthcare, and the creator of 30 plus iPhone applications. Now, as the Chief Medical AI Officer at Helpp.ai and Strategic Advisor for ChatGPT, Dr. Castro is transforming global clinical workflows and patient care through cutting-edge AI advancements. Dr. Castro's visionary leadership has earned him features on CNN, Dr. Phil, Fox, ABC, and he continues to inspire AI experts worldwide. Today, he's going to share his transformative vision for the future of healthcare, one that's driven by AI, large language models like ChatGPT, and groundbreaking innovation. So without further ado, please join me in welcoming the Dr. Harvey Castro. Thank you very much.
All right, guys. Well, honored to be here. Fun times just to be able to talk to you guys. It just reminded me, there was a bookstore called Major's Bookstore when I was a med student in Galveston, and They, big picture, they allowed me to have a Harvey's Corner there at Major's Bookstore, which was in the medical center. And I was able to do book reviews, and I had a whole area where I would say, okay, for this subject, you should do this book. For this subject, you should do that. And the owner would call me all the time. It's like, Harvey, they keep stealing your list, and I keep having to print it because people just take your list. And it was just kind of fun memories to know that that's down the street. So my goal is to go over the presentation, and then I'm definitely leave time, and I want to make sure I answer everybody's questions, and I know there's going to be a lot. So I figured let's answer questions at the end, because there may be some questions you have during the presentation. They're like, oh, wait, he just answered that. And so just to set the mode, it's a little Terminator music, and then...
Listen to me very carefully. That's one of my mission parameters.
Dr. Castro, could you share your screen? I don't believe
Trust
we're
me.
able to see it.
Oh, really? Okay, no, I'm
Yeah.
glad you said that. It says I'm sharing, but let me stop sharing and
Yeah.
share again. And okay, can you see it now?
Solid. There we go.
All right, so let's play this real quick.
Listen to me very carefully. That's one of my mission parameters. I'll drive. Trust me. Now listen.
As a patient advocate, I'm excited about the potential of AI in healthcare. I enjoy following Dr. Castro on LinkedIn.
Accurate early disease detection, groundbreaking.
This technology promises a future where care is customized to each individual's unique health profile. Keep up the good work, Dr. Castro.
Yes, predictive diagnostics within reach.
Thanks to innovation in this field, personalized healthcare is becoming accessible to all. I'm happy to see that Dr. Castro wrote the first book on ChatGPT and healthcare back in 2022.
No more injuries undetected.
Hi, as an AI researcher, I collaborate with medical experts, like Dr. Castro, to develop technologies that predict health risks, personalize therapies, and support surgical procedures. Our aim is to leverage AI to not only improve health outcomes, but also to save lives.
VideoGen AI medical imaging transformed.
The new iPhone 18 will leverage small language models. I am excited to see what applications Dr. Castro will create. He has several Apple Vision Pro applications out.
As a patient advocate.
So all my slides obviously have AI. That was a huge deep fake. This is the worst it'll ever be. It's only going to get better. I wanted to show you this quick video in that this animation, all I did is I took this slide, I entered it into AI, and because of this slide, it took that text and made it into that video, which is crazy that we're at a point where we can just text and create videos. This crazy picture that you see here is all the startups as of March of this year. And as you can tell, it's in all the different industries. And so this is getting big. It's getting crazy in the point that we need to make sure that we're aware of where we're going. And the more we understand this technology, the more we can use it in healthcare and do things. And I'm going to show you some fun stuff. Now, I literally just got back from South Africa speaking at a conference for pharmacists around the world. And the best part is the accents that were out there. And so when I came back, I had a little bit of envy when it comes to accents. So I deep faked my face, and then I used one of their accents to read my slide.
What are the AI components in healthcare? Definition: artificial intelligence, AI, simulation of human intelligence by machines. Key components: machine learning, ML, algorithms that enable computers to learn from data and make decisions. Natural language processing, NLP, allows machines to understand and respond to human language. Computer vision enables machines to interpret and make decisions based on visual data. Robotics, application of AI to perform tasks that typically require human intervention.
And to make it fun, what I did is obviously I cloned my face, and then I used different AI to take that transcript and make the different scenes. And then if I wanted to, I have my own voice cloned, and I could have just swapped out that voice and put my voice. And so in the future, I'm going to show you some applications in healthcare, how we could do that. What are the AI? Now, you ask, all of us are here because we're in healthcare. We want to make a difference. Our heart is in what we're doing. We wouldn't be doing medicine because we wanted some money. We wanted to get rich. If that was the case, you wouldn't have gone through all that work. So in my heart, I know that you're here for the bigger goal. And so this is a story about this young boy. His name is Alex. He's 4 years old. And this poor little kid, imagine a child that's running around in the playground, having a normal kid life. And then suddenly he started having pain and got to the point where the kid stopped going to the playground, literally stopped doing kid activities. And the mom, her name was Courtney, she took her to 17 doctors over a 3-year period, and they could not figure out what was wrong. The kid got x-rayed, MRIs, multiple visits, multiple specialties. One of the specialty docs thought he was making it up, that he was fine. But big picture, this poor mom, Courtney, bless her heart, she took all that data, all of it, put it into AI, and AI came back and said the differential diagnosis for this is possibly tethered core syndrome. She went back to the neurosurgeon. The neurosurgeon went through all the films and said, oh my gosh, I see it now. I missed it. And so now I'm happy to report that kid is fine. He's running, he's playful, he's doing a kid thing. And this is why I always put this slide in my presentation, because to me, this is what AI is about. It's about making a difference and leveraging technology. And so as we look forward at this technology, it's exponential. Our organizations are logarithmic. And so the bigger the gap becomes between technology and your institution, we're going to start seeing a revolution in the sense. We're going to see your organization start saying, you know what? We need to start using this AI. We're going to start creating some FOMO, where a hospital across the street or a system across the road or another medical school is going to start saying, you know what? We're leveraging AI this way, and it's going to cause pressure. And so as these things start happening, we're going to start looking at the different models. I love this slide because it goes through our IQ. Average person, somewhere between 90 and 100. Average doctor, somewhere between 120 and 130. Just to give you reference, Albert Einstein and Elon Musk are somewhere between 150 and 165, depending what study you're reading. But this is the take-home message on this slide. When you look at the different models, you can see that back when we started with ChatGPT 3.5 in 2022, it was saying it was an average of an IQ of about 126. And as you start looking at these progression of these models, they're actually getting bigger and bigger, but they're getting smarter and smarter. And so now we're at a point where we're saying, you know what, some of these AIs are at a PhD domain expert. And in the future, it's only going to get higher. And with prompt engineering and using a combination, we're actually seeing higher results already. And so it's going to be really interesting that in your lifetime and in your practice, you're going to start seeing this as part of your daily job. And I want to encourage you that when you look at these things, that don't be scared of it. And I'm going to explain why I don't think you should be scared and why you should embrace it. Now, I had different people reach out and say, hey, Harvey, I want you to give us a little basic of like, where'd you come from? What's going on with you? Like, this is really interesting because we haven't met a doctor that really understands AI and has the business. And so this goes back to when I was 18. Didn't have any money to go to college, so I decided to join the U.S. Army and I served our country. From there, I was really motivated to just think outside the box. So at age 16, I had my first business. I had my own vitamin business, and it was paying for my car, my insurance, my daily living. I was doing pretty well. Fast forward, I mentioned here in Major's Bookstore, I was doing book reviews to help me get free books in med school, and I literally had the best medical school library than anybody because all the major bookstores were giving me free books to review, and then on top of that, all the publishers were allowing me to give their manuscripts or different editions, and I would edit them. So when I was a med student, I probably published over 15, 20 different books that I was in for helping them review it. And so as I moved forward, I always thought, how can I help others? And at the beginning, I was helping medical students. I was taking cliff notes and selling up to the other medical students because let's say you guys are doing neurology now, I would have 8 and 10 different books, and I literally would have in my room 8 books open, and I would just speed read through all of them and say, okay, this diagram's good, this picture's good, let me consolidate, let me learn this, and let me teach it, and then let me create some notes, and I would sell them. As I move forward, when I was in when I was in graduate med school and I went into the residency of emergency medicine, I noticed that at the time, holistic medicine was becoming a thing where it was like, man, if you can combine vitamins and create something. I created a heart vitamin formula, and it was basically a formulation to help with patients with heart disease. And I know you can't make any claims like that, but I made a formulation. I got a cardiologist to give it its blessing, and I was able to get a manufacturer, create my own label, and I took that label national, and I sold that as a resident. And as soon as I graduated residency, there's this thing called the iPhone. And when that came out, I thought, man, I was coding a patient. I was in the emergency room. This patient's literally dying. And I told the nurse, hey, we need to start this drip. And I told her, and she's like, 1 second, let me get the textbook out. And she starts thumbing through it. And she's like, all right, let me verify. Let me get a calculator. And she did it. And then she's like, all right, doc, I'm ready. And I'm looking at the iPhone thinking, man, there's got to be a better way. What if I create an app and I tap it 3 times and boom, here's my dose and let's go. And so I was able to create the first IV Med app in the world, and it went viral. And so I was able to leverage my MD, this problem that I saw in technology, and I said, we're going to do something. In Texas, we can create freestanding markets. At the time, they were just starting to pop up, and I thought, man, what if I create my own emergency room, my own way of practicing medicine, my own way of delivering the way I think healthcare should be delivered, and instead of being told how to do it, I'm going to start my own system. So I was able to create over 20 emergency rooms. 8 of them I packaged. I created my own micro hospital, my own urgent cares, emergency rooms. I had my own billing company, staffing company. What else did I have? Billing company. And I was able to create a system of healthcare the way I wanted it to practice. And I was able to teach doctors a certain way that that's the way I thought it should be done. And so as I continue to move forward, I was able to play with ChatGPT on the first day in this office. And I'm typing away and I'm playing with ChatGPT. And I thought, this is huge. This is going to change the way we practice medicine. And so I literally wrote the first book on how to create, how to use ChatGPT in healthcare. And I launched it in 2022. And because of that book, I'm going to encourage people to, follow your dreams. My wife actually told me, do not do it. Do not publish that book. People are going to think you're crazy. People don't know what this is. You'll be the first one out there, and people don't know what you're speaking, and you have a book. You're going to look silly. And I actually held it for a week. And then I thought, you know what? My heart tells me this is the right thing to do. My heart tells me this is going to do well, and I'm going to do it because I think it's going to change medicine, and boom. And as a result of that book, I was able to give talks all over the world. And because of that, I can now say I'm an advisor for the country of Singapore. I'm an advisor for the Texas Medical Association. Different healthcare companies are calling me to give them advice on insurance and hospitals and how to use AI. Simultaneously, I love giving talks. I'm giving this talk around the world. And then the last is I'm having some fun. I'm using my experience as a doctor of 20 years of emergency medicine. I'm using my experience of all these companies that I've started, and then I'm bringing in AI. And I've actually studied AI. So I have 3 certificates on different types of AI and learning the science, not just like superficial, but really going into the data science. And so now I'm in this unique position that I'm able to bring all these worlds into one and now present it. And as a result, I'm having fun creating different products. You guys know when you're in the clinic and you're seeing patients that you're thinking, man, I wish we had X. Well, here's now AI, that slide that I showed you of the IQ. You put it together, man, you're going to create something big. And so the last thing I just released, I have multiple products, is this thing called Speaker Plus AI, where I could take this video feed it into my AI, and I get a 3 to 5 page report on how well I delivered. Was my story good? Was my hook good? Did my delivery do a good job? Did I use my hands? Did I go too fast? Was I going too slow? Was I nervous? So I'm doing that in multiple other countries and things like this. So the bottom line is I want to encourage you to keep doing what you want to do, follow your passion and follow your dreams, because you'll be shocked how much you'll be able to do. Now, this is the one slide that I'm going to say I want you to really focus and really pay attention to this one slide. And it's pretty simple. I truly believe that it's going to take the human plus an AI. It's going to beat the best human. It's going to beat the best AI out there. So let me say it again. I truly think you working, your personality, your clinical gestalt, what your personality brings, that person plus AI will beat me alone or beat the best AI alone, because you're leveraging that. Remember that slide I just showed you where it's showing that higher IQ. With medical data, depending what you're reading, some documents out there say that the medical data is doubling every 30 days. I mean, there's no way your professors can read every single journal, keep up with all this, and still have a life. We need something. To me, that something is going to be AI helping us, give us information. I clone my voice. I have an agent out now that is a AI agent that goes out and scrapes information for emergency medicine. And so once a week, I get all the latest information for ER specific to me and what I need. Since I'm into medical AI, I have different agents that will go and find information for me and bring it to me. There's no way I can keep up with all the journals. But then this way, I'm able to extract what exactly I want. And so I'm going to encourage you to use that human plus AI idea. Now, I'm sure most of you guys use podcasts. I'm going to point you to this and I'll just do a quick demo. And now this is a podcast, but this is an AI podcast. And think of you going on Google and you asking questions and you can interrupt this thing. And this is live and it's free. Can you tell me about AI and healthcare?
Oh, this is a fascinating area. AI is making waves in healthcare with some groundbreaking developments. Firstly, scientists have developed a simple blood test using artificial intelligence that can predict Parkinson's disease up to 7.
Can you tell me? I'm going to keep going, but the skinny on that is imagine now being able to talk to your podcast and just have a conversation and being able to interrupt and ask instead of getting on Google or your favorite Reddit or whatever post, you can just have a conversation if you're driving, you're walking, you're working out, and it's just talking to you. I mean, how fun. I'm working on a product right now that my goal is to use AI to record the conversation in your classroom, and then that AI will create an MP3 so that when you're driving back home, you're getting an MP3 of the summary of the lectures you just saw for the day. And then you fast forward that by the time you take that first test, now you're getting the best parts of every lecture, and then that's another podcast that you're listening. Everybody's heard of structured data in the sense that we know that radiology has this information and it's structured in the sense that it's digitized, it's already ready to go, and the AI can manipulate. So it's no surprise to see stuff like this, that it says the AI is reading the CAT scan, it's finding nodules, it's looking at the EF. That's old news. We know that it's doing a great job with that. We know that there was this thing called IBM Watson that everybody's like, man, this is going to be the best thing in cancer and oncology, and this is going to save the world, and that didn't do too well. But I'm here to say there's other companies now. That company went bankrupt basically, and Soul was a failure. But in my mind, it wasn't a failure in that they were trying to do too much and the technology wasn't there. But the technology is there now. So we have companies like Tempest and Encore Medical that are actually doing what IBM Watson wanted to do. So it's really interesting to see how time has evolved and these, like I mentioned, technology exponential. And now we'll be able to do things that we couldn't even do 6 months ago. And so as we look forward, I want you to pay attention to the different products out there. The World Health Organization made this thing called Sarah. She speaks eight different languages. She's available 24/7. She's focused on tobacco, mental health, eating healthy, and physical activity. And this is just a quick little sample.
Hi, I'm Sarah, and it's so nice to meet you. Human health is my specialty, and I want.
And so I just wanted to show you that real quick because at the end of the day, these are the things that are going to be in your clinic. It's going to be done by different institutes. This is going to be common. That is, you're going to laugh from it in about a year from now when you see the other ideas that are coming out, the better AIs. But this is where we're at today. And imagine being able to give that customer service and that person that may not be able to get healthcare now having that information. Maybe they need help with their smoking cessation. Well, now there's this bot that's able to walk them through and answer all their questions and available 24/7. The other thing that's out there is this thing called Hippocratic AI. And I'll play a little bit and we'll go through it.
This is Linda calling from Memorial Hospital on a recorded line. Is this Albert Wu?
Yes, it is.
Wonderful. I'm calling on behalf of Dr. Brown, your cardiologist.
And I'm just going to pause it in the interest of time, but imagine having a bot that's listening really well. And imagine the emotional intelligence, how many times, and you guys can already think of certain doctors and nurses and people that you're like, man, that was pretty rude. Their emotional intelligence is pretty low, or, that they really should have had a better tact in saying X, Y, and Z. This AI is only getting better. This AI that they're selling is basically a nurse that they're charging $9 an hour for the hospital. And the idea is the nurse would be able to take an intake form. So in this particular case, it's going to go over medications, side effects, and then make an inventory, and then create a summary, make sure everything's correct, and then present that to the physician. And so this is things that are happening now. Obviously, this is causing a lot of uproar. People are upset that this technology exists. I know in California a couple of months ago, we had nurses fighting over this and saying that they were protesting because this is a big deal, and I understand why. The other part to this is the admin. I at one point owned emergency rooms, hospitals, and I thought, man, if I could have the AI do a lot of the stuff that's repetitive, that's boring, and give the AI that, and then let me have more time with my patients, I'm in. And so obviously, it makes no sense that if my computer is facing to my left and I'm typing and I'm looking at you every other word, that I'm really not listening to you. Because they've done multiple studies that show you cannot multitask, although all of us think we can. In reality, we can't. Imagine a patient we all know our patients lie to us. You ask them how often they smoke, how often they drink. You know that number is not correct often. But if you're not even looking at them, how are you going to catch those little subtle cues, those little subtle language and nonverbal cues? And so we look at the different systems that are out there that are scribing, that are creating, and the more you guys are going to start doing different presentations, you're going to start seeing this being a fact that, hey, yeah, we're going to start seeing more in AIs out there. I created this thing called MediHelper. It's free. I just created on the ChatGPT, and all it is as follows. It's a simple GPT that I tell my patients, hey, before you come see me, run your questions through here. And if you don't know what to ask me, run it through here. So that by the time they see me, it's like a preemptive strike. They're like, okay, I have diabetes. Here are my diabetes questions. I have hypertension. Here's this. Here's all of this together. What does that mean? That way, when I see them, the average time of a doctor-patient interaction is only 13 minutes. And so now they're really coming prepared. And I'm like, what a way to use AI. Now, I mentioned emotional intelligence. There's a company called Helpp.ai that is analyzing my face, my voice. Believe it or not, I could take anyone's conversation here, upload it to this, and it will tell me if you're depressed, if you're assigned for Parkinson's disease. Some of the claims that they make, obviously, it hasn't been approved by the FDA, but it's crazy to know that this AI is actually listening and watching. So I just give you a quick demo. Hello, my name is Dr. Harvey Castro. Here I'm going to show I'm smiling. See, it's saying joy, and then it's saying just quiet, bored, and then it's going through the different types. And then you can have a conversation with the AI. Hi, my name is Harvey Castro. How are you? And then it's picking up on my tone, my emotion.
I'm doing just great. Thanks for asking. So what's new with you? Anything exciting going on?
Let's just show you that little glimpse, because imagine this being used in healthcare, being used so that we're able to get better triage or better customer service. And this is all had. Today, I was able to get ChatGPT on my phone in the sense that they added the I call it the emotional intelligence voice on here, and it's pretty darn good. And I'm thinking, man, if they have this, in the near future, you won't ever have a bad customer service experience, because they're going to be doing such a good job with hearing what you're saying, answering. You won't have to repeat yourself, and there won't be any lag time, which is crazy. And so as we move forward and we look at the different applications of this, this is one right here that makes me really excited. What I did with children is the following. How often do you see a child that when you try to discharge them, you really can't speak to the child, you speak to the parents? And so imagine a child that's 5 years old and just got diagnosed with asthma. You start talking to them and they're already running or on their neb, and you really don't have time to explain to it because they don't want to give you that time. But what if I told you I took the discharge instructions and I extracted the core concepts? What am I trying to convey? Asthma prevention, taking their medicines correctly. And then I took those principles, I fed it into AI, and then I had those principles create a coloring book, and I made those pictures. And instead of giving the parents papers, I give the child a coloring book, and now I can color with the kid and go over these core principles of why they need to take the medicine and how to prevent asthma. And they're actually understanding because I'm speaking their language. And so one of the things I have done is started cloning my voice.
Technique for children.
This is my clone
Managing
voice.
asthma triggered by sports. Correct inhaler technique for.
And so now I can literally just take any discharge instruction and now customize it to my voice. I'm working on the video portion so that it looks like me and actually sounds like me. And I'm going to show you another presentation, another slide here in a minute. You're going to be like, wow, this is crazy. And then you're going to say, well, What do you do with your teenagers? Well, I did the same thing. There's an LLM out there that I can create my discharge instructions like a comic strip. And so I have that. And then for the adults, I have where I created this gptpodcast.com. About a year and a half ago, I cloned my voice, my business partner's voice. I can take any blog, any website, any information, discharge instruction, put it in here, and then it'll make it into right now I have it set where it would make a podcast, and it's a conversation between my business partner and I, which we never had. And then it'll actually make the image, the transcript, the file, and within 5 minutes, I can upload it to Spotify. The other thing I've been working on is putting AI into plushies. And so imagine a case where maybe you have a child again that is going through chemotherapy or is going through several days at the hospital and has an itinerary of they have to go to the blood, they have to go get chemotherapy, they have to do this, and it's a whole day mapped out. But who's really talking to the child, explaining this is the MRI, explaining this is the blood work, or answering questions? And so what I'm working on is a prototype. I'll just play a little bit of it. It's got a lot of lag time, and I wanted to check it out. Hi, Grok. How are you?
Hello, Dr. Castro. I'm feeling charged up and ready to explore with you.
Tell me about this. So I'll stop there, but the skinny is, imagine being able to program this and being able to go back and forth and then put the child's favorite character's voice on here and really giving medicine in a different way and really understanding that. And it's really fun to see. The other part is I found this LLM that I thought, man, this is huge. What if I have a patient that is deaf and now I can create with LLM sign language? And I just put my discharge instructions into the LLM and now it's giving sign language. What an amazing feat. I mean, freaking amazing that I can communicate with others this way. And so these are the things that AI is allowing me to do. Now, this next slide is really interesting. Microsoft, I'm guessing, will not release this until after the elections. Look at this picture carefully. This is this young lady's picture, and all you need is a picture of anyone and an audio file, and obviously this program. Literally, picture, audio file, and then what this program does, it puts them together and animates that picture. But look at her eyes, look at her facial muscles.
Have you ever had, maybe you're in that place right now where you want to turn your life around and you know somewhere deep in your soul there could be some decisions that you have to make, like it's like something was decided for you, and have you ever had
that is crazy. But now imagine this on the healthcare side. Imagine I'm discharging a patient and I'm dictating. I can take that dictation, my picture, and now I can give that to the patient, and it's an animation of me giving that discharge instruction. How often have you diagnosed a patient with something terminal cancer or something really hard that patient's like, I call it the Charlie Brown moment, that you say it, and then at that moment on, you know they're not listening to you. They're just still processing what you just said. But imagine if I could videotape that and save that information and now give that to the patient. So when it's 2 a.m. and that experience is over and they're like, wait, what did Dr. Castro tell me? Now they can see it, hear my voice, see the animation on my face, and it looks real. I mean, that's the better way to deliver healthcare. Old news here is obviously we have telemedicine and we have wearables, and I really am excited about the marriage of this where we're able to take advantage of edge technology, telemedicine, all this information, put it into AI and create better projects, better predictions, better future. I truly believe we will live longer because of this, and we will catch things earlier, which brings me to the next point. With Parkinson's disease, there's a new blood test that literally you can diagnose Parkinson's disease 7 years before it actually happens, or you can predict rather that it's going to come 7 years before it happens. And this is old hat. I mean, there's multiple different technologies that we're starting to see this and more. And one of the things, I just interviewed the CEO of this company called Limitless. And imagine, again, speaking to your doctor and your patient and you're having a type, we're going to start seeing in your lifetime these little devices where patients are going to record everything that's going on, and it's going to transcribe everything, and they're going to be able to talk to their AI agent here listening to what you're saying. So I know some of us, for legal reasons, we don't want that happening, but the sad truth or good truth, depending which side you're of the coin, this is going to happen, and it's here today. And so we're seeing different technologies like that. Again, I just deep fake myself reading this
Limitless
slide.
pendant preserving conversation.
I won't play it, but the skinny is imagine being able to go to school and record your notes, have conversations where everything is logged. I'll give you a quick workflow. I was at an interesting conference on AI and they were talking about investments, and I was able to transcribe the entire conversation and I plugged it into the podcast. And then on my way home, I was able to hear a podcast on a conversation that I just heard, but it gave me the 10 minutes and the top information. They had mentioned some interesting facts that I didn't know, and I shared that with my business partner, but I gave him the podcast. This is what you and I will be able to do more and more. My business partner created this company called Helpp, and it's really interesting. Imagine patients that are at fall risk. Imagine a monitor that is over the patient's bed, cannot see the patient's face, but it can predict if that patient's getting out of bed. And so before they've gotten out of bed, it's predicting, hey, your patient's about to get out of bed, and it's texting the nurse, texting the doctor, and saying, hey, we need to this patient's a fall risk. We need to address that patient. And so one of the things we're adding right now is voice. And so before that patient gets out, if that person's Hispanic or different language, it's able to speak in their language and say, hey, sir or ma'am, please wait, we're coming. And then we're adding this. So our goal is by next summer, we'll have this in people's homes. And so if you have a loved one that they maybe should be in a nursing home or they're kind of right there, maybe they maybe shouldn't, we'll have sensors where you'll be able to get a text notification saying, hey, your mom just took her medicines twice. Hey, it's 8:15 and your mom always gets up at 8 due to predictive analytics, but it's 8:15. This is not her typical self. You may want to check in on her. So this is something we'll have here in the near future. As we start moving forward, this will just be old hat, I think. But the main thing we need to worry about is, and I know Praveen was asking me about how did this Dr. ChatGPT come out? And this is basically part of it. When I was a med student, my faculty and doctors hated Google because they used to call it Dr. Google. And so fast forward, people started calling me Dr. ChatGPT. And then with all the different models that have coming out, now they're calling me Dr. GPT. And it's kind of funny. I'm even progressing the way they call me. But I made this flow chart, and it's pretty simple. We need to keep a human in the loop. We cannot let AI create its own information and then hallucinate, and then that patient or doctor's using that information unsupervised. We need to have some doctor in the loop. And so I gave this diagram to hospitals, and I have it in my book that I wrote last year. And all it is keep a person in the loop, but keep the right person. So if I'm an ER doctor, I should only verify ER information through AI. If you're a dermatologist, that's what you should do. I have no business in, say, neurosurgeon because I'm not a neurosurgeon. So that's what that slide is about. Obviously, the big picture, I'm talking to medical students, and my personal worry is I have 20 years of clinical gestalt. If AI lies to me or hallucinates or whatever you want to call it, I feel pretty confident that I can call it out. But I'm more worried about you guys because you guys are just starting. You don't have that clinical gestalt. You're like, maybe it's right, maybe it's wrong. And I'm worried that there'll be an overdependence. When I was a med student and resident, I used to love foreign doctors because they would come and they would do a hell of a great physical exam because they didn't have a CAT scan. They didn't have the luxuries. Here, I feel like we're kind of spoiled, and sometimes we're like, let's run that test and it'll be there. But I really loved watching other doctors, and I'm worried that the next generation of future healthcare professionals will be overly dependent on AI to the point that it sincerely worries me, because one day I will be that elderly patient that you'll be taking care of, and hopefully you'll be able to combine both and get really good outcomes. Obviously, the challenges here is culture. You know, I jokingly and lovingly say, if I'm in East Texas and I give this presentation, I get a lot of hard looks. If I'm in Silicon Valley, California, I get high fives and hugs. And so there's a culture change. And so depending on your culture, depending what's going on in your institute, this will be received differently. Obviously, there's ethics and regulation. We got HIPAA and we got FDA, and depending on what AI and how you're using it will fall into one of those. Obviously, in healthcare, everything's in HIPAA. But with that said, there's ways to address that. There's ways to educate. Case in point, everybody's here listening to this talk. You're all educating each other on the topic. To overcome these challenges, I truly think we need to change the culture. You guys are the future. I lovingly ask my younger population of friends and family, hey, would you let a robot take your do a root canal in 15 minutes on you, or would you rather have a dentist? It was interesting. Everyone that was 20 and under said, "Oh, I would let the robot do my root canal, especially if you told me it was 15 minutes." Everyone that I asked that was older, all of them said no. And so what that told me that there's going to be a big shift. And when you guys are in power and when you guys are running the hospital systems, you guys are going to do things that my generation will not. And I'm not saying that's good or bad. I'm just saying there's going to be a change and we need to be ready for that change. And that's why I'm glad that you guys are here. Now, my other favorite phrase is we don't know what we don't know. And we don't know what this technology is going to bring. I predict that we're going to start seeing developing countries like Africa doing things before the United States. I truly think because of regulation, lobbyists and things and supply and demand and these kind of things. For example, if you ran a village in Africa and you knew it got zero health care, you're probably more likely to call Elon Musk and say, "Hey, I need your satellites. I'm going to put a trailer with a bunch of computers and I'm going to send one person there to take care of that village." And that's their health care. That would not happen here in the United States. But these are the type of things that is going to pressure the United States to make some changes. And it'll be interesting to see where we go with this. My other favorite phrase is, "Damn if I do, damn if I don't." I truly believe doctors are going to be sued for using AI. And at the same time, I think doctors are going to be sued for not using AI. Give you a quick example. I'm an emergency room doctor. Some of my colleagues have this cool AI that if a patient comes into their emergency room and they suspect a head bleed, the AI will text the doctor, the radiologist, the whole crew saying, "Yep, I detect blood. This is more than likely a stroke," and they're able to jump on the patient. They're able to take that priority in the radiologist and say, "Yep, that's a bleed," and they put it to the top. Let's pretend that across the street, a hospital says, "No, we're not buying that." Well, I could see a lawyer saying, "You know what? My patient had a bad outcome. They had just gone across the street. They would have been okay." And so I'm really worried that we're going to start seeing some things that may not equate to medicine, but because of legal reasons, we're going to start seeing this shift. At the same time, for not using AI, and at the same time, using AI, using it wrong, in my opinion, you're going to get sued. People ask me all the time, "Well, if the AI made the mistake, that's not on me, it's on the AI." And I keep telling them, no, the AI doesn't have a license. You have a license. The AI claims it knows medicine, but you know medicine. No different than getting a potassium that says 8, and we're like, "Ah, that person would be dead if it was an 8. Let's run that again." Same thing with AI, just another tool. So as we look at the future,
I had a revelation, a vision, a picture in my head, a picture of this, the flux capacitor.
I truly think the following. I think we're going to see a huge run on wearables. We're going to obviously see more blockchain used to secure our patient data. We're going to see more edge technology. Case in point, our iPhone, and I'll give you an example in the next slide or two of how that would work. But I really think we will see robots in the hospitals. I predict by the year 2026, you will have a robot. That robot I foresee will be a physician assistant equivalent, my scribe. And let me give you a quick example. My voice right now, AI can say if I have Parkinson's disease, can say what my sugar is, give my rough hemoglobin A1C, how old I am, all this different data. Imagine if you're my patient, I'm going to examine you, and then the robot is able to say, "Oh yeah, his sugar is this, or this is the range. This is just a screen." And I'd be able to take that data in real time. Imagine I'm examining you, and the robot's able to say, "Yeah, the differential diagnosis is this," but he never looked at that patient's ears. And he either tells me through VR or texts me in my ear, says, "Hey, you forgot to look at that patient's ear, and that's part of the differential diagnosis. You need to go back in there." And so now I'm able to use that AI as a scribe, as a sparring partner in the way, give me that extra information. Imagine a nurse that has a bad back says, "You know what? I'm getting older. I'm not lifting any more patients. I'm either retiring or I'm changing a job." But what if I told that nurse, "You know what? Here's a robot that's going to lift the patient, walk the patient, help you with the ADLs, and this way your back is not out. The robot's going to help you." I really, really think with the population aging and less healthcare professionals, we need to do something. And that something to me is going to be AI plus robot plus human. And I really think we'll be starting to see the first cases here in 2026. And the other thing is that slide I mentioned, all that AI, there's different flavors, big ones, small ones. They're putting small ones into the iPhone. This is a new iPhone. It has a small language model. Give you a quick case in point. Imagine you're in the Grand Canyon, zero Wi-Fi cell coverage. Patient keels over. Let's pretend you're not in healthcare. You could take that phone and you can put the LLM on there where it will have CPR. And the the small language model will be able to say, you're going too fast. You're going too superficial. You need to go deeper. And then you can take that phone and point it to the satellite and send a text to get an ambulance, a helicopter to come down and save that patient. We will be able to see stuff like that. I know the American Heart Association is already working on some stuff that they haven't announced yet, but in what I think is going to happen, it's going to be something along these lines. I'm wearing the Humane AI pin. With this thing, I can translate, I can take pictures, I can call, I can text. My goal is to get the API access to my digital twin, where I can call my digital twin on stage and ask questions, and I hit it and it talks to my digital twin and then it translates. But imagine having this as a pharmacist and being able to give information, and if I forgot something, be able to recall it. This is just a simple tool that's out there, but I truly think this will be the future. I have the Rabbit R1. I can imagine taking a picture of an EKG. Obviously, we're going to make sure it's HIPAA compliant. This is just pie in the sky thinking, but this thing costs $200. My iPhone was almost $2,000. If I was a hospital administrator, I'd rather spend $200 than $2,000 if I could get away with it. But imagine if I took an extra, imagine that patient came in having chest pain. I could take a picture of the EKG, interpret it, and then it's saying, you know what, it is a STEMI, and then it automatically texts the team, texts the cath lab, texts the hospital administrator, all with my voice. This thing right now is set up with Midjourney, so I can make any picture with this. I can put any AI song with this. I can just say, hey, I want a song on XYZ, and it'll make it. And I truly think this is the next thing that will be developed more and more, and we'll see more and more of that. Obviously, the other one is the Ray-Bans. These Ray-Bans came out this year, and I already know they're going to make another one, and it will have augmented reality. But being able to take a picture of the screen, see how much the screen is worth, or in healthcare, say that's Lyme disease, or interpret an X-ray. This is what we'll have. Obviously, the other ones we have is the Apple Vision Pro, and being able to, when seconds count, have that information in that lab pop up, and say I had a drug overdose and I'm not sure what that drug is, and be able to take a picture of that pill, and then it'd say, oh, it's Tylenol overdose that you're dealing with. And so for fun, when the first ChatGPT 4 came out, I took a random X-ray, EKG, and pill, and it did a pretty darn good job. It read the EKG just like a medical student. It read that chest X-ray just like a medical student would do it, and it did a good job. And then on the pills, I need to rerun this study. It's just me doing it. And out of 4 pills, it got 1 right. The other 3, it did not. But I thought, man, if you put a RAG model, meaning you put that database into it, and it would get a higher probability of getting it right. And so when I mentioned the Apple Vision Pro, imagine getting labs in real time and being able to see it. I'm almost done with the slide so we can jump into questions. But the other one is AI can read your mind. And you're like, what the heck? Well, through fMRIs, it's able to look at the wave patterns, and they're able to see what those wave patterns, and then work backwards and say, this is the image that you're seeing. So now based on those wave patterns, they can say, yep, this is what the image that you're thinking of, and it's doing a pretty good job. So here's what is viewed, and here's what's predicted, and it's pretty darn close. The other one is in the winter, we'll be getting these little thing called IO1 AirPods, and I won't go into them, but the skinny is being able to use noise cancellation in real time, translate. So if I used to work in Las Colinas, and it was next to the airport, and anybody that got sick would come always to our hospital first. And so I would have all these different languages. But imagine if I could just tap it, and then when they spoke, I could hear them in English. That's what this device will be doing. And so I won't go into that. Meta has announced this experiment where the signals that you're thinking through that are coming through your arm, it's able to be detected. And then that information can be sent to the virtual world. Imagine patients with strokes, and if it's able to get some of that signal and being able to type with their thought. Sounds like Neuralink, but this is just through this little bracelet. I'm going to end with a couple of slides, and this one is just, at the end of the day, follow people that are optimistic, realistic, doers, knowers. One of my friends sent me this slide and say, Harvey, I feel like you're right in the middle. You're doing, you're realistic, but then you're also optimistic. So follow different people. Come to things like this so that we learn and teach others. I made these cheat sheets. You're welcome to have them. Just it's on my LinkedIn, and then I'll give you a QR code that you can get them. But the skinny is how to use ChatGPT in healthcare. On my website, I created my own digital twin. If you go to the resource period, that little arrow, I put all my books, all my interviews, presentations, and then literally you can have a conversation with me. And if you're on your desktop, I added my voice to it. So then you can hear my output, and then it's my voice going back and forth. I won't play this song, but it's just AI. And then I just put a prompt, and then
Hasta la vista, baby.
and then that bottom diagram was Google created this cool, like, you could put letters in it. That's all healthcare pictures down there. So anyway, I wanted to jump into Q&As and appreciate your time.
Dr. Castro, that was phenomenal. Like, I'm sure everyone echoes and agrees that you being like an insider for a lot of these big companies, seeing exactly where they're going with the next 5 years of AI application devices, it's honestly, we're very lucky. We're lucky to be like, we see people that are isolated, clinician experts, technology experts, entrepreneur experts, but there's rarely a combination of someone that has all three. And so for those that are attending, this is your perfect opportunity to ask any questions to Dr. Castro. We have a lot as well to ask.
Yeah, and I know you had some that you wanted to answer. If you want to start first, we can hit yours because I know you had really good questions.
Yeah, I mean, I think one thing is this. What are the biggest takeaways that you've learned being an expert in these three different industries, like of how to succeed actually, how to succeed in entrepreneurship, how to succeed in technology, how to succeed in healthcare, and really fuse it? Because there's only a few people that are doing what you're doing in this world.
You know, at the end of the day, I'm going to say follow your passion. That's my passion has always been healthcare, but I'm a dude. I love gadgets. I love toys. And so I always was fascinated. And then the scientist in me, like you guys, you want to know how this stuff works. So you're always wanting to know more. I think I have a strong why. I come from nothing. So that's always wanted me to push myself. And even after I've quote unquote made it to the top, I always keep pushing myself and pushing myself to do more. And so that's just in my DNA. And so I'm going to tell you, one, find your why, find the reason why you became a medical student, why you wanted to be a doctor. And then after you get to that goal and after you go through residency, ask yourself, what is my why? Because what I see some doctors is they get to that point and they're done, which is nothing wrong with that, but you want to use that why to push you to do things. The second thing I want to say is when you're an entrepreneur, you got to do it. Find someone that complements it. Just like marriage, you find that better half. Find that person that will do. My business partner, he creates all my AI. He can build anything. I lovingly call him my Wozniak, and I call myself the Steve Jobs. And together we complement each other and create literally anything we want. And so I'm going to encourage you that if you're lacking in X and Y, find that business partner to complement you, to take you to the next step. And the third thing I'm going to say is look at life like a ladder. It's an infinity ladder. It doesn't ever end. And it's the productivity ladder. You want to keep going up that rung. It doesn't matter how fast. It just matters that you're going up that rung. It doesn't matter if it took you a year, 5 years, 20 years. The fact is that you're going. And with those three things, you guys are going to kill it.
Amazing. That's amazing. Another question we had is you talk about merging audio and video with AI to create these like customized, personalized solutions. That in some way has overlap with deepfake technology. And so how do you go about thinking of the ethics behind the ethics, the trust, the security boundaries with deepfake, these type of concepts in healthcare?
Yeah, no, excellent question. I'll give you a real example. Someone I met that I pseudo knew asked me for my voice, and I hesitantly gave it to him. And then he gave me a copy of my voice, plus he promoted himself. And I'm like, dude, I didn't authorize for you to use my voice to promote it. I said, you know what, we're just gonna end this conversation. I'm not gonna use your product. And that was an issue. I've only trusted my business partner with my voice, my deepfake, and moving forward, I'll more than likely only allow him and I to have access. But moving forward, for your question, I think the key is going to be having the hospital make sure it's the secure server, no one else can do it. But the sad part is these technologies are getting easier and easier that anyone could take anyone's voice and picture and do anything. And so if you go on my YouTube channel, I did a thing with Dr. Phil and I talk about deepfakes, and it was kind of fun. We deepfake the reporter. The deepfake has me introduced in the deepfake, and then we talk about how to prevent it. And one of the key things that I tell people, including my family, is let's have a safe word. And so if it sounds like me, looks like me, ask for the safe word and see if, because we want to make sure it really is me. My own mother, I mess with her. I gave her my GPT podcast. I sent her audio. She's like, "Man, you sound good. That was a good presentation." I'm like, "Mom, that wasn't me. That was my AI that did all of that." And so if I can fool my own mother, then it's getting good, and it's only going to get better. These deepfakes.
Yeah, and it requires us as like future healthcare providers to be so intentional when like doing all these change management tools. So we have another great question in the chat. Can you comment on your experience with different AI scribing softwares, Freed, Nabla, Scribe? Have you incorporated any of them into your workflow? What's your experience been like that?
Yeah, at the end of the day, I feel like I'm a prisoner to my hospital system. So it's whatever hospital system X or Y says you need to use this. So when I speak to my colleagues, if they wanted product X or Y, it's just such a mess because they're like, yeah, even if I wanted it, I have to wait till the next business cycle or they have a 5-year contract. So I've enjoyed different ones. The way I see it is this technology is only going to get better and all of them will improve. I think they're doing a better job with HL7, making sure that there's better compatibility among the different EMRs and different systems. I recently consulted a company out of Africa, and they were now some of the things I was suggesting. They're like, "Yeah, our system is so screwed up. We would have to build everything from scratch because they're not talking to each other. Like all the systems we have don't talk to each other." And I'm like, "Whoa, that's pretty bad." So. But I've enjoyed all of those. I've enjoyed Nabla. I've enjoyed. I think it's just cool to be able to like Nabla. Not that I'm paid by them, but to be able to put it into my Chrome and it's in my Chrome, and it's there and transcribing and noting. And I was like, wow, this is kind of nice. Because if I had a side hustle business when I was younger, I could totally use that and it wouldn't cost much.
No, that's fantastic. Yeah, we got a comment saying Nabla is awesome. That's great. One thing is right now we're all these attendees today and the people that are going to get the video, we're all in Texas Medical Center, the largest academic medical center in the world. We have dental schools, nursing schools, medical schools, a bunch of different variations. What advice do you have for us in terms of like coming together to like help with AI change management and the shift that's going on?
That's a good one. I think at the end of the day, it's all about education. The more you know, the better. So I love that outline at the beginning. Make sure you're going through all of that. And here's the beauty. This life is exponential. So even if I came back in a year, it's going to be a different talk because it's just changing so fast. Let's keep up with it. Find your specialty that you really want to do and hit that hard. That would be my advice. Just educate. Just like you're learning medicine, learn AI. I'm not saying go out and spend money and buy an AI course. You don't have to, but just learning this information, learn the basics, and learn how to pivot. Your way of learning and the way of doing things today are going to be so different by the time you're in residency. And then by the time you're out in the world, it's going to be so different from even residency. So learn how to pivot, learn how to adapt, be adaptable. I'm not crazy about the phrase that people are like, hey, you'll be replaced by people that use AI. And if you don't use AI, I'm like, well, it's more learning how to pivot, learn how to think outside the box, be able to morph and change. And I think that's such an important tool in your life. If I look back of how I started to where I am today, I've pivoted a million times, just being able to turn and see things. And if you're going to stay in your lane, then know your lane really well.
That's good. That's good. Like, for example, if we're a nursing student, know nursing really well while making sure we're educated with evolving AI. For a medical student, just know our field really well so that we can apply and integrate essentially. Okay. That looks amazing.
Yeah.
Well, we want to respect your time. We want to more than anything, thank you so much for offering your time. For those that don't know, Dr. Castro is traveling around the world. Singapore, he was in Kenya. He's giving talks to everywhere and everything around the country, and he offered his time to speak and share value with us. So thank you so much, Dr. Castro. We're going to share this with the entire Texas Medical Center. We have your I think or your socials. Everyone has them in the chat, so that they can go ahead and follow you. And then can we go ahead and send the attendance form for anyone that wants to stay involved with cool initiatives like this? We have people from the White House that worked with the White House, Google, Stanford, Harvard, Duke. They're all coming in the next couple of weeks to months. Like, stay involved. You don't have to be part of McGovern. You don't have to be part of healthcare, but you're going to get the knowledge that we all should have at this point. If we can just send that in really quick, and it's a quick 30-second form. You just fill it out, and you're going to be updated with all of our emails. There we go. Emily just sent it out. But yeah, thank you so much for your time. For those here, thank you for joining us on your evening. Dr. Castro, if you could stay back for a few moments, but thank you, everyone. Hope you enjoy your evening.